Hi, I'm KM, an associate professor from the School of Life Sciences, the Chinese University of Hong Kong. In this video, we discuss the toxic effects of particulate matters from air pollution. First, let's take a look at the characteristic of the particulate matters. They are particles, and thus we could classify them into three classes: fine, medium, and large particles. Anything larger than 10, mainly from 10 to 100 micrometer or microns, is regarded as large particles. From 1 to 10 micrometers are medium. Smaller than 1 is fine particle. Anything smaller than 10 are regarded as RSP, respirable suspended particulates. Altogether, we call them total suspended particulates, TSP. Large particles of the sizes over 10 micrometer cannot get inside the respiratory tract. For example, pollen from flowers could be a strong allergen. Cement, coal dust, and fly ash are all visible particles in the air. As we can see from the diagram at the corner, these large particles could be trapped in the nasal cavity and the thorax from the nose. Smaller particles, smaller than 10 or from 1 to 10 micrometers, are known as medium particles, with PM10, PM2.5, PM1. The numbers refer to the particle sizes. Also, fly ash contains smaller particles: insecticide spray, paint pigment, cement dust, coal dust, diesel engine exhaust. As they are small, they can penetrate into the respiratory tract from the trachea to the bronchus and inside the lung. The RSP respirable suspended particulates also include all fine particles with sizes smaller than 10 micrometer. They include carbon black, oil smoke, smog, tobacco smoke. They are the most dangerous particles as they could travel deep inside our lung, bronchial tube, into the alveoli. Therefore, obviously that clinical problems from diesel exhaust, for example, are well known to cause inflammation, with increasing B cells, T cells, mast cells, platelets. Other factors like histamine, cytokines, and adhesion molecules like ICAM and VCAM are being induced by diesel exhaust with particulates. For asthma patients exposed to air pollutants like diesel exhaust, they become more sensitive to methacholine challenge, also leading to airway resistance result with increased interleukins like interleukin 6, interleukin 10. From an earlier study performed by Professor Wong of CUHK, similar to results found around the world, NOx, SO2, PM10, and ozone caused increased hospital admissions with respiratory and cardiovascular problems as judged by the odds ratios. Noting that diesel exhaust contains not only particulates, but also mixing with other chemicals, the toxic health impacts of these air pollutants are obvious. In a recent study by Professor Wong, also in Hong Kong, health hazards are found linked to air pollution, and the socially deprived populations had higher impacts or even mortality risk. Looking at the RSP, especially the FSP, fine particulates smaller than 1 micrometer, including oil smoke, smog, tobacco smoke, they can travel deep inside our lung, bronchial tube into the alveoli travel deep inside our lung bronchial tube into the alveoli. Inside the alveolar sac, they can cause many toxic effects on cells and even get through the epithelial cell layer into the bloodstream. For example, they would kill macrophage cells, causing inflammation onto the mucus layer to cause oxidative stress, going over the epithelium with more cell damages and inflammation in the blood vessels. Inside the blood, they can go to the liver, causing the release of more coagulant factors, increasing the coagulability of the blood. In summary, the particulate matter PM gets into the lung can cause cardiovascular effects as they can get over inside the pulmonary system to cause redox activation with the phase 1 and 2 enzymes induced. They can also provoke the catecholamines with pulmonary neuroinflammation, mononuclear cell activation, and endothelial cell activation. As a result, cytokines, adhesion molecules, endothelin, and fibrinogen from the liver, causing blood clot as acute toxic effects of the particulate matter PM. The clinical outcomes of the acute toxic effects of the PM are increased blood pressure, cardiac arrhythmias, or even arrest. Chronic effects from low doses of PM cause progression of atherosclerotic lesions in blood vessels and the heart. Lastly, because of the factors and enzymes being induced by the particulate matters, we can use them for our Tier 1, Tier 2, and Tier 3 monitoring of oxidative stress caused by the particulate matter PM. Tier 1 is for antioxidant response. Tier 2 for inflammation. 3 is toxicity caused. The table here lists the markers for the pathway or genetic markers and biological markers. The clinical symptoms are also well noted with reduced susceptibility in Tier 1, asthma and atherosclerosis in Tier 2, and airway hyperactivity in Tier 3 result. Thank you for watching. In the next video, we focus on lung cancer as caused by air pollutants. This video explained what these particulates are, how they can get inside the lung, affecting or damaging the alveoli, causing oxidative stress, inflammation, and cardiovascular diseases. Goodbye.